Now, what if? What if, on the other hand, there were clear measurement points? Measurement points that we could actually see how the individual was progressing relative to this line here. And if there were a measure here and we could see that this individual had been making good progress, but then they were discharged and things stopped. Each of these measurement points are opportunities to reflect upon what the individual's needs are from a very broad perspective, potentially. Do they have psychological issues that need to be addressed? Are there cognitive issues that have never been raised and addressed? Are there still ongoing physical issues that the person really should, maybe means a different intensity, different type of physical treatment, a work conditioning, a work hardening program? None of this is occurring to really tell us along these measurements what are the patient or client's needs. So what happens is you end up with poor rehab outcomes, you end up with increased mental health issues, you end up with increased family crisis and breakdown, because the longer a person is away from work and not progressing towards work, and depending on an insurance company and its whim as to whether they're going to continue to pay this individual income replacement, especially since oftentimes those income replacement benefits are only a fraction of what they were earning before anyway. It's increased financial burden and crisis, obviously burden to other systems, including welfare, including ODSP, Canada Pension Disability. Oh, statistically, if you've been out of work for basically 2 years, the chances of ever going back to work are less than 10% at 2 years and dropping after that. Okay. So 50% after 6 months, 20% after 1 year, 10% after 2 years, and plummeting from there. Okay. So clinical coordination and vocational model would be more along these lines. This is the ideal recovery curve, obviously. Okay. This is where we all want to be with appropriate support and rehab. If we don't have appropriate rehab and support, we want to be able to know where the person's shortfall is going to be. So there are going to be some occupations that no matter how much rehab the person has, the nature of the injuries that there are going to be permanent impairments for some. And some of those permanent impairments might translate into, I will never be able to lift, carry, stoop, bend physically. For some it might be, I've had a traumatic brain injury, and no matter how good my rehab is, I will always be less able to manage to cope with stress. I might be always less able to cope with the highest level multitasking demands, analytic demands, memory, problem-solving demands. On the emotional side, again, I might just have a certain level, because of pain and sleeping poorly, a certain level of lower level coping. So maybe I'll never be able to be a good manager again in a high stress kind of environment. So we want to be able to learn as soon as possible where this realistic plateau occurs. And as soon as we know that plateau is there, we want to institute vocational rehab. So many orthopedic surgeons will tell you that with certain injuries, they will tell you from that day that this person will never go back to that form of work. So if we know that here, why are we waiting 2 years later to start the voc rehab process? Why aren't we saying to, Mr. Smith, this is a situation. Let's do a vocational assessment right now. Let's understand your aptitudes, your interests, your intellect, your learning abilities, and find a field for you to go into. It's only, you're still going to be physically recovering. You might as well be doing something school-wise or retraining-wise if you possibly can. So that's an example. Those kinds of things don't happen that often, but at some point in time, there is a certain reality about every single injury as to whether they're going to go on to complete recovery and have complete activities of daily living and ability to perform the person's pre-accident occupation. And there's always a point in time where that this trajectory plateauing is known, or it's there in fact, but we need to put measurement tools in place so that we can identify at what point we're putting resources into trying to move the person forward and into full physical, cognitive, emotional recovery, and when we need to switch from that to being oriented towards modifying the home, accommodating at home in terms of physical accommodations, for example, but same in terms of the workplace and all those dimensions as well.